inspection, auscultation and olfaction, inquiry, and palpation, are collectively known as the four diagnostic methods of traditional Chinese medicine. They together serve as important foundations for diagnosing diseases and prescribing specialized treatments, which are also required courses for studying traditional Chinese medicine. Nkrumah Seth, from the Republic of Ghana in West Africa. With the aspiration of using traditional Chinese medicine to help more people in his hometown to stay away from illness and pain, he came to Liaoning province in China alone, and embarked on his journey of studying traditional Chinese medicine. For diagnostic methods of traditional Chinese medicine were first proposed by the famous physician Bianchu during the spring and autumn and warring states periods. They were summarized based on previous experiences and practiced and refined by generations of physicians. These methods remain indispensable diagnostic approaches in traditional Chinese clinical practice. The core of these four diagnostic methods lies in the concepts of holistic view and specialized treatment. The holistic view holds that the human body is an organic whole, in which various internal organs, meridians, vital energy and blood are interconnected and mutually influential. Any localized pathological lesion may be closely related to the overall condition of the body. Specialized treatment involves using the information obtained through the four diagnostic methods to classify diseases in terms of different syndrome types, and then formulating corresponding treatment plans tailored to the specific syndromes, so as to achieve the goal of specialized treatment. Inspection diagnosis refers to inspecting by eyes the patient's overall and local conditions, including expression, complexion, physical shape, behavior, and excretions, so as to understand the patient's health status and condition. Inspection diagnosis is the first of the four diagnostic methods in traditional Chinese medicine, and is also one of the most intuitive and simple methods in traditional Chinese medical diagnosis. Auscultation and olfaction diagnoses include listening to sounds and smelling odors. These two methods are used to understand health conditions and diagnose diseases. Listening to sounds primarily refers to listening to the patient's voice, cough, breath sounds, vomiting sounds, etc. Changes in the pitch, loudness and clarity of sounds can reflect the cold or heat conditions of the internal organs. Smelling odors primarily refers to smelling the various odors emitted by the patient's body, as well as the odors of secretions and excretions, such as bad breath, sputum and mucus, and the odors of urine and feces. A strong foul odor often indicates a heat-related illness, while a fishy smell or no odor may indicate a deficiency syndrome.
头晕也偶尔有，前一阵体检有过高血压，然后平时说话比较少，然后总是出汗。
Inquiry diagnosis is a clinical information collection method through direct verbal communication between the doctor and the patient. By inquiring about the patient's medical history, symptoms and treatment process, the doctor can comprehensively understand the patient's condition, providing a reliable basis for specialized treatment. Palpation diagnosis, including pulse feeling and body touching. Pulse feeling is a diagnostic method where doctors use their fingers to feel the patient's pulse, perceiving the characteristics of the pulse response to their fingertips, so as to understand the condition and assess the disease. Pulse feeling is an important basis for syndrome differentiation in traditional Chinese medicine. Through changes in the pulse, one can ascertain the condition of the internal organs, the vitality of energy and blood, and the flow of pathogens and healthy cells, as well as the exterior or interior, deficiency or excess, cold or heat nature of diseases. Body touching refers to doctors using their hands and fingertips to touch and press specific areas on the patient's body in order to gain insight into the patient's condition. Body touching mainly involves checking for thoracic and abdominal masses, skin swelling, limbs temperature, and the pain location, which helps doctors understand the condition of the patient's superficial lesions. Traditional Chinese medicine emphasizes the combined application of the four diagnostic methods. During inspection, there is auscultation and olfaction. During auscultation and olfaction, there is inquiry. During inquiry, there is palpation. Only by comprehensively and thoroughly examining the patient's condition can a correct diagnosis be made, thereby prescribing the appropriate medication for the patient. Nowadays, with his academic achievements, Nkrumah Seth seizes every opportunity to help local people in Africa. Thanks to his efforts, the local people have gradually begun to accept traditional Chinese medicine, and their recognition of traditional Chinese medicine has been increasing.
To all those watching and wondering why I have decided to study Chinese medicine, this happened some few years ago when my mother was diagnosed of kidney failure leading to her death. So I decided to prevent this to many others like her who are also suffering from this predicament. After long and hard search, I found myself at Peony University of Traditional Chinese Medicine, where I have been able to study for 10 years and have equipped myself enough with the knowledge of traditional Chinese medicine. And as to this day, I'm able to help my local authorities and local area people to have a better health. My dream is to turn this Chinese medical philosophy into a world theory.
The story of Nkrumah Seth learning traditional Chinese medicine showcases the potential and charm of traditional Chinese medicine on a global scale. At Liaoning University of Traditional Chinese Medicine, an increasing number of international students are not only studying the culture of traditional Chinese medicine, but also contributing their own efforts to promote the internationalization of traditional Chinese medicine. The story of the great traditional Chinese medicine continues to unfold.